Are you concerned about your bone density decreasing, especially as you're aging? Well, don't worry. I've got 9 great tips for strong bones and teeth, especially with that remineralization process. Some of the symptoms of your bones losing that mineral density include, of course, weakness in the bones. It could be in the teeth as well. The teeth could actually be falling out. You may be more prone to fractures and breaking your bones, and this is something that definitely you want to be able to not experience, especially as you age. But here are my 9 tips for those strong bones. Tip number 1 is to do more exercise. So we know that specifically weight training and weight-bearing exercise, so lifting weights, they don't need to be super heavy, but doing some type of resistance training, especially for women, is really, really strong to have and maintain those strong bones. Tip number 2 is to chew real food. What does that mean? This is especially for the bone structure in the jaw and for strong teeth. You want to chew real food, and real food often can be a bit on the harder side. A lot of, think about it, processed foods often is very soft and easy to chew, but you want to chew some real food because that will help to have those compressive forces on all of the structures in the mouth, really helping to strengthen those teeth. Tip number 3 is to follow Mother Nature's prescription. So what does that mean? If you've not seen some of my other videos, it means getting out in natural sunlight and having that early morning sunlight exposure, especially also midday sun, and as the sun is setting. As much natural light in your environment as possible is going to do a lot for helping to have that healthy metabolism, especially of your calcium and your other minerals for those strong bones. Grounding, so getting outside with bare feet on the earth and exposing as much skin to that bare earth as possible to pull in those earth's electrons into the body has a natural anti-inflammatory effect, but helps with the building of strong bones as well. Tip number 4 is to avoid fluoride, chlorine, bromine, bromides. So this halogen group, if you look at the periodic table, if you remember from science class back in probably grade 8, grade 9, those halogens are very compromising to what's going on with your other minerals in your body, namely your calcium, your magnesium, your iodine. This is going to offset and is toxic to your body and will offset that proper balance for your other important minerals for strong bones and teeth. Tip number 5 is to fix your leptin resistance. So if you don't know what leptin resistance is, please see, and I have a specific video on this, how leptin is actually related to your osteocalcin, which we know helps to mineralize and remineralize your bones. So that is something, another video that you can check out. We'll put links to that video in the description below. Tip number 6 is to increase your seafood consumption. Now, seafood over the years has gotten a bad rap, but seafood is loaded with minerals, and that's important. So things like magnesium, things like calcium, iron, as well as your DHA, so those important omega-3s, your zinc as well, really important to help to maintain that proper balance of your minerals in your body and to give you some of that natural calcium. Tip number 7 is always maintaining that mineral balance. So what does that mean? That means in terms of magnesium, calcium, sometimes you may need to supplement with a vitamin K2, and I like an MK7, which is naturally occurring, as well as vitamin D, and it's D3. So whether you're getting enough sunlight exposure with that UV to make your own vitamin D3, or if you need to go to, a high-end supplementation of that vitamin D3, this is really important for your overall health, and of course that bone density, because all of these minerals work along with your vitamin D3. Tip number 8 is to detoxify heavy metals. Heavy metals are going to rob your body, when you've got heavy metal toxins, rob your body of your essential minerals, because your essential minerals, things like magnesium, calcium, will come out of bones to help to trap or chelate some of those heavy metal toxins. So this is really important when you're finding out, maybe you've had some testing done that you have some heavy metal toxicity, things like mercury, aluminum. You have to do your best to get those heavy metals out of the body. One of my favorite things to use is chlorella, spirulina, blue-green algae that are known to help to chelate in a safe and effective and natural way to get those heavy metals out of your body. And tip number 9, that mind-body connection. So when we're talking about strong bones and teeth, let's think about how soft we are Or do we need to sort of stand up for ourselves a little bit more? Do we need to get a little bit stronger, harden and toughen up a little bit? Think about that connection, because often everybody's talking about the diet and, you know, doing other great things in terms of exercise for strong bones and teeth, but not too many people are talking about that mind-body connection. So what does that mean to you? Maybe you've got to toughen up a little bit from the inside out and on an emotional level. I hope that helps you and shed some light on that mineralization of your bone density. Hopefully your bone density will improve if you're struggling with this. For more information though on how to fix your leptin resistance and its effects on osteoporosis, please check out my video, Leptin Resistance and Osteoporosis. I'll see you there.